Well, despite the grim news about new mutations, the number of infections has been falling. However, health experts say that is not a green light to forget masks and social distancing.
The Maidstone and Tunbridge Wells Hospital Trust says it's been battling an extraordinary second peak in Covid patient numbers, almost 4 times the size of during the first wave last spring.
Well, their intensive care units are still running at double their usual capacity, and to show the scale of this problem, they invited our reporter Kit Bradshaw and camera operator Mick Kelly inside the ICU at Tunbridge Wells Hospital. Kit sends this now.
The teams here at the Maidstone and Tunbridge Wells NHS Trust have been dealing with what they describe as a huge influx in coronavirus patients over the past 4 weeks. The pressure here is so great that they've got 2 intensive care units now, a green ICU for non-Covid patients and a red ICU for coronavirus patients. And the managers allowed us exclusive access into the red ICU to show the public what pressure their staff are under, but also how deadly this virus can be. And as you might expect, my report does contain some scenes that you may find upsetting. Thank you.
We often talk about the front line of this pandemic. Well, this is surely it.
The red intensive care area. So all the patients we have around here are the Covid patients.
Only the sickest are transferred here. It's a dedicated coronavirus intensive care unit at Tunbridge Wells Hospital, set up in a ward previously used for day patients.
You have patients in their 20s and 30s who are fit and well normally. You know, they're not all ill patients beforehand, but they've often ended up in intensive care.
I've come to log into my break at 10 o'clock, just triggering 70%. Okay.
The team here are currently caring for double their usual capacity of critically ill people.
For a lot of these patients, the numbers we're really looking at is how much oxygen there is in their blood. We've got 4 who aren't on ventilators and we've got 6 who are on the ventilator.
In normal times, Dr. Andy Taylor works in the operating theatre.
It doesn't seem to be a disease that turns around very quickly.
He's one of many who've had to switch roles as this NHS trust faces a second peak of Covid patients almost 4 times the size of the first.
We've been, the whole of Kent and Medway is stretched, the whole of us are under pressure. We've managed to take some patients from our local hospitals who have been more stretched than we have. So the pressure's still on for everyone.
They've learnt a lot about treating this disease, but staff tell me it's still highly unpredictable. A ventilator has been breathing for this woman for 29 days. Under the blankets, a man is lying on his stomach, a technique used to help boost oxygen levels in the blood.
Although the number of coronavirus cases is beginning to level off, the message from the doctors and nurses working on intensive care units like this is they're still incredibly busy and the public need to stick to the rules.
Stay at home as much as you can, wear a mask, because we are struggling, and just if we don't keep our guard up, then there's a real risk that numbers could start to increase again. And unfortunately, with how stretched we are, there's a real risk that care could start to suffer as a result.
We are tired. It's 11 months of we had a short break and it's just getting ready for all over again. But for me, and I think for my colleagues, it's not just physically tiring, it's emotionally tiring. And that's what we're getting more. It's because we are here with the patients, and every patient we lose, it's just we take all the pain from them and from the family home, and it's very difficult to offload all that because the next day you're back and you have to go all over again.
One of the patients who isn't sedated is keen to talk to us.
Sure.
Stephen MARFLEET has been here for 11 days, but this one is special as it's his 69th birthday.
Tried to convalescent myself by thinking of my family, my grandchildren.
He clutches a toy they've sent him and looks at cards from loved ones who can't be here to hold his hand.
I tried to keep safe, but I'm unlucky. But I'm strong, and I know I shall survive.
And what's your message to people who are still breaking the rules?
If they would like to wear this mask for over 20 days, well, Good luck to them.
Mr. Marfleet's wife, Christine, has allowed us to show this interview. Despite the best efforts of the staff on this unit, he sadly passed away just 48 hours after we spoke to him.
When I found out that Stephen Marfleet had died just a couple of days after we spoke to him on Friday, it came as a real shock, not least because, as you saw in my report, he was one of the less seriously ill coronavirus patients that we saw in intensive care. He was sat up in bed, he wasn't on a ventilator, and he was very keen to talk to us. His family sent us this photo of him in happier times. They wanted to stress that the staff did an amazing job. They said they are true angels. Now, if there's a glimmer of hope this evening from here, it's that the number of new coronavirus admissions at this NHS trust has started to decline. It's down by about 100 from its peak last week. And the managers here are keen to stress that if you need help, be it for COVID or any other illness, you should seek help from the NHS.